Hi, everyone. Welcome. Come in, come in. As you come in, if you don't mind, we'd love to have your videos on, but if you don't mind muting. Hi, everybody. Welcome. We'll give everybody another minute, and then we'll get going with Monica. I see some familiar faces here. I welcome everybody. Our names, really names, right? Okay. Welcome, everybody. If you don't mind, I'd love to have your cameras on just to see everyone, but if you don't mind, please mute so Monica can focus. We'll go ahead and get started. I'm very excited to have Monica Jane with us tonight. Monica is a physical therapist and also a master clinician at Mount Sinai Hospital. Monica, welcome.
Thank you.
Okay, everyone. So we want to definitely encourage questions and interaction. Please use the chat for that function. Monica plans to present for about 30 minutes tonight, and then she'll take questions at the end. So please ask questions. Hopefully we have lots of answers. And Monica, I'm going to go mute myself, and the floor is yours. Thank you for being here.
Thank you, Sarah, so much. Thank you for having me here and giving me this wonderful opportunity. Good evening, everyone, and welcome. Thank you for taking out the time tonight from your busy schedule and joining us. I'm super excited to share the practice of gratitude, and I'm looking forward to connect with you all. This is one of my favorite practices. So let's get started. Today, I'm going to share what is gratitude? Why should we practice gratitude? How is it related to our well-being? Evidence supporting the gratitude practice? Different ways that we can practice gratitude mindfully? And most importantly, how to implement gratitude in our personal life, in work life, and with the patient's plan of care. Before I jump into the theory aspect, I would invite everybody to join me in a quick gratitude practice. So if you can take a mindful pause and keep aside whatever you are doing and join me for a 2-minute practice, that would be awesome. If you are in a position where you can have a seat, I would encourage to do that. And if you feel safe, then gently close your eyes. Just focus on your in-breath and out-breath. Feel the inspiration and expiration and the pause in between it. Just bringing the attention without trying to change anything. And now, take a small, gentle, deep breath in through your nose and out through your mouth. One more time. Slow, gentle, deep breath. And now, think about 2 things that you are grateful for today. It could be anything, having the good health or your coworker, something good that happened with your siblings, parents, partner, whatever comes to your mind. Think about 2 things that you are grateful for today. As you think about those two things, experience the emotion and the feelings that come with those two memories. It could be the joy or the smile or just peace, whatever is that emotion, just observe and experience without judging it. And now think about one thing that was the best part of your day today. Just thinking what was the best part of your day so far. It could be just sipping a cup of coffee or had a good lunch, or you connected with a friend with whom you never met for such a long time. Whatever that best part is for you, think about that and feel that emotion and the experience in your heart. And slowly and gently open your eyes and welcome back to the session. So, why we did this exercise, you all will discover by the end of this presentation. Now, let's think about what is gratitude. I'm sure all of you are familiar with this word gratitude. It was derived from the word gratia, which means grace and gratefulness. It's a quality or a feeling of deep appreciation or thanks of what is meaningful and valuable to us. The quality of being thankful, readiness to show appreciation for, and return the kindness. It is about feeling the right way about the right things and at the right time. Why should we practice gratitude, right? What is so important about gratitude that we should bring that in our day-to-day lives? As the rehab professionals, right, we are always like running around, we have endless notifications, worries, uncertainty. I mean, think about it, as our day pretty much runs on an autopilot mode. And on top of that, imagine if we get more life stressors and challenges, how much emotional toll are we paying for our body, mind, and soul? We cannot change the stressors and the life's challenges and ups and downs. That is how it comes and it occurs. But what we have the power is to how to handle these stressors and emotions and the life's ups and downs, right? That is where the power comes into the picture. Handling the stresses with resilience and acceptance is what we all want in our lives. That no matter what life brings in, we should be able to handle them with ease, calmness, and clarity. And mindfulness and gratitude are the two tools that can help us to be and access that power. So, practice of gratitude can help us develop more resilience, acceptance, grace, and surrender. It kind of rewires our brain for more joy and less stress. And who wouldn't like to have that, right? There are tons and tons of studies that have consistently identified strong benefits of gratitude for our mind, body, and relationships. Studies have found that gratitude increases dopamine, which is we all know as a neurotransmitter which for reward, motivation, and pleasure. It increases the oxytocin and serotonin by activating the parasympathetic fibers of the vagus nerve and releasing the serotonin, which will help in the mood, digestion, and sleeping. It has been proven that it increases resilience, happiness, and life satisfaction. Gratitude also improves the quality of sleep. It builds emotional awareness, and studies that it increases the greater activity in the prefrontal cortex, which is responsible for making the decisions with clarity and without getting emotionally charged. It improves the relationships. It reduces the stress and anxiety by decreasing the hormone cortisol. And at work, it increases the productivity professional commitment, and responsibility at work. And all these benefits are supported with the evidence, which I'll cover in the future slides. Studies have found that people who practice gratitude are helpful, happy, and forgiving, right? I mean, who wouldn't like to be having all those three qualities? Because this is the foundation of who we are. We always want to be helpful, happy, and forgiving, no matter how life comes in the external circumstances. In a nutshell, with all the benefits of gratitude, if we practice gratitude, it's going to make us emotionally a happier you, at physical level a fitter you because it kind of motivates you to do the exercise and take care of your diet. Socially, you'll be a better you because there is a lot more resilience and there is a lot more acceptance of the situation and how to handle the relationships. And professionally, you'll be a smarter you because it increases the productivity, it increases the quality of care with the patients. Gratitude leads to connection, closeness, and happiness. It enhances the sense of well being, relationship to see yourself, others, and things in a very different way. So, let's talk a little bit about gratitude, mindfulness, and well being. Well being is such a simple word, but if we look into it, it has a lot of depth and breadth in it, especially like with the pandemic that we all have gone through. You all might have realized that how important it is to take care of our well-being. It's not just the physical or the mental part of it, the emotional part comes into the well-being too. And well-being is directly related to our stressors. Like if we can handle our stressors in a way that it doesn't take our emotional toll, we want to have a better well-being. Rick Hansen, a neuroplastic expert, said that brain is a velcro to negative experiences and Teflon to the positive, right? And you all would agree with me that whenever there are like negative experiences, we tend to hold it so long. And when there is a positive experience, it just kind of slides off. Like think about it as, when was the last time that you remembered a compliment that was given to you? But if something went wrong, then that would just linger on in our brains because that's how the brain has been programmed. It is a velcro to the negative experiences and Teflon to the positive. But what can the practice of gratitude do? The practice of gratitude, it amplifies the positive, it creates the positive, powerful memories, and in turn, it does the lasting changes to the brain. And this is all supported by evidence. Gratitude is an antidote to the negative spiral. It can really cut off the negative spiral. Sometimes you might have noticed that we go into that catch 22 cycle where we can't pull out from the negative situations. But gratitude is one of the resources where you can really use it as an antidote to the negative spiral. Let's talk a little bit about gratitude and health. Gratitude improves the sleep, tendency to exercise, cardiovascular health, adherence to medication, and it improves the mood, optimism, and hope. It reduces the substance abuse, fat intake, cortisol, blood pressure, suicidal thoughts, inflammation, and perceived stress and depression in healthcare providers were found to be significantly reduced in one of the studies that we'll see in the coming slides. We cannot agree more, right? John Henry Jowett said gratitude is a vaccine, an antitoxin, and an antiseptic. Let's look into the science supporting the practice of gratitude. I have broken down the science into three levels: the one with the patient's workplace and at the personal level, so that it's kind of easier to understand because we are going to use this practice of gratitude at all the three levels. So, at the personal level, gratitude was found to be a game changer in people who practiced 5 minutes of gratitude for 10 weeks. And the results were 25% they were happier. And one of the study that was done with the healthcare providers, there are like tons of studies in different areas like the school teachers, government offices, everywhere. But I just limited myself with the healthcare provider studies so we can be more streamlined with our profession. So with the healthcare provider study, what they did was they wrote down the gratitude practice twice weekly, and there was reduction in the stress level by 28%, and depression was less by 16%. And such positive effects can lead to an improvement in both productivity and the quality of the patient services. Now let's look at gratitude in the workplace. Surveys have shown that when we say thanks and when people hear thanks, they are found to be happier and more productive by 50%. In general, thank you from a supervisor boosts the self-worth and self-efficacy. The gratitude recipients becomes more trusting and more helpful. And supervisors, they give the compliment and they kind of appreciate at the end of the performance, at the end of the year when they do the performance appraisals and the reviews. But just like, taking it to the next level and thinking about if in the day-to-day activities, if they found something appreciative and if they can express it, and we all do it at a certain level, but just creating a mindful awareness that how much are we doing it and can we take it to the next level will really create a big impact on our just the workplace environment. And it goes vice versa. The employees, especially with the management and its administration, it's so easy to find things that are going wrong that we don't like. But if we train our brains to see one positivity, it will help us to see that positivity. And then sharing it with them will make the relationship much more connected. According to the US Department of Labor, the number one reason why people leave their job is because they don't feel appreciated. And that is really an important aspect to look at. We all want to go to a workplace where we feel appreciated and acknowledged. And it's the same thing, whether you are a professor, whether you are a manager, whether you are an employee. At the basic level, it all comes about appreciation, acknowledgement, and just expressing the gratitude towards the effort for the other person. Now let's look about gratitude in the patient category. So what the studies in 2015 was done, which was done for the mental health counseling, the adult and college students, they were divided into three groups. Group one wrote one letter to another person for 3 weeks. Group two wrote about their deepest thoughts and feelings about the stressful expressions. And group three did no writing activity. And I'm sure you all might have guessed the results right. That yes, group one did report significant better mental health than the other groups. Now comes the gratitude with the heart patients. So in 2016, there was a study done with stage B heart failure patients where they took the blood samples, they measured the heart rates while they were writing the gratitude journal. And interestingly, people who were doing the gratitude journal when they were being recorded, they showed healthier resting heart rate in the lab. And those who kept the journal showed fewer biological signs of worsening the heart diseases. There was another study in 2016 that was done with the recent acute coronary event. So they were asked to report on their gratitude levels right afterwards, keep the track for 3 months, and then 6 months later. And people who were able to record the gratitude activity, they were found to have the heart problems engaged in more healthy behaviors, and they reported better quality of life. Having said that, it is being proven. There are like tons and tons of studies. I just kind of limited the studies, but all The three levels are supported by science that gratitude helps at the personal level, the workplace, and with the patient's plan of care. Now comes the question that, okay, we understood what is gratitude, why is gratitude, but how do we practice gratitude, right? So there are 8 methods that we can bring gratitude into our day-to-day lives. One is gratitude journal, which I'm sure each of you might be familiar with. If you are a writing person, this is the method to go with. It's always good to kind of like sit together, like start writing, and then, be consistent with the practice. Even if it's like 5 minutes writing a journal, that will take a big transition when you start writing it at a consistent level. And also make sure you notice the small wins, not just like bigger things, but even the day-to-day wins is really going to make a big difference, because gratitude allows us to notice the small wins, and these wins kind of makes a web for our well-being. Then there is a gratitude letter. If you feel that appreciative or acknowledgement to the other person, then gratitude letter is the way to go. You can write an email or you can send a letter. Then we have meditation. Gratitude meditation, like unlike meditation, what we do is we take a time and then think about 3 things that we are grateful for and feel the expressions and emotions behind as we think about those memories. The one exercise that we kind of did it in the beginning of the session, that is the gratitude meditation. Then we have gratitude jar. This is nothing but simply take like a transparent jar. You can put it in the office at your workplace, or you can put it in your kitchen area at home. All you do is put a sticky note and pen next to it. So whenever there are like any small things that you feel appreciative, grateful, or compliment for each other, you write down on that sticky note and put it in the gratitude jar. And at the office, you can do the same thing. If you feel appreciative about someone, or if you want to compliment someone, just put it in the gratitude jar. And then you can read them like, every quarter, every month. We did this exercise in 2019 as a family, and we chose to read all the gratitude jar notes on the eve of Christmas. And it kind of turned out to be very special. And there was like very unconditional love in the space that we all felt. Then we have gratitude ritual. This is something that you can set up based on your environment and the family setting. So, like we as a family, we do at the end of the day, when we all are ready to go to sleep, we think about 3 things that we are grateful for, and we kind of like bring it to specificity, that why are we grateful for. For example, the kids will say that I am grateful to mom for X, Y, and Z reason. It's not just like I'm grateful to mom, I'm grateful to dad, I'm grateful to my teacher, because that doesn't allow you to connect to the depth of what you are saying. But reaching out for specific feeling, it really trains your brain. And in the beginning, it's not easy. Like my kids hated it when they started. They're like, do we need to do today? And like gradually I would be like, okay, let's not do 3, let's just do 2. But in the long run, it really makes a big difference. I'll quickly share one personal story. So we started this gratitude ritual when my son was 5. Now he's 8-year-old. So at the age of 7, I think, like, so he was like running in the house and he fell and he broke his left radius and left ulna. It was around 8 p.m. So we took him to the ER first. Then somebody in the ER said that it's going to be a wait long time. Why don't you take him to the orthopedic urgent care center? So we took him there, and they couldn't fix it there. He needed a manipulation, so we needed to go to the ER, again the ortho ER. And then like in midst of everything, this poor boy who is having like pain 10 on 10, holding his left hand, I'm sitting next to him in the car, my husband was driving. In middle of that, He says to me, Mom, do you know one thing? And I'm like, what? He says, one good thing is that I'm so glad that it happened to my left forearm. At least that way I can use my right. In that moment, I felt so much peace, like the situation was the same, but there was something that got transformed and it gave me a very different amount of energy. And I was like, this is how it really impacts in our day to day lives. That training made it so much easier for him to look at the positive amid that pain of 10 on 10 with the fracture. That is how I feel like it is so passionate to me, and this is why I love this practice. Then comes the social media. If you are a social media person, then you can make a commitment of like maybe posting one thing that you are grateful for during the week, or maybe take a 365-day project. Whatever feels easy and doable at your end, choose that. And gratitude conversations. Like conversations are such a common thing into our day-to-day lives, right? We end up having conversations every 10, 15 minutes. So how can we bring this practice into the conversation? So whenever you are like, for example, you are meeting at the dining table for the dinner, you can just start with like, what was the best part about your day today? Rather than thinking, how was your day? Like Monday mornings, we are so on an autopilot mode. We're like, how was your weekend? But do we really even like pay attention to the other person, what he or she is saying, right? So just asking about what was one best part about your weekend, or what was the best part that has happened so far, that would open up the whole new space. Or you can start with like, when you are in the meetings, what did we do right so far? There are always problems that needs to be troubleshooted, but just opening the conversation with like, what have we done good so far? This is the good things that have happened, and now let's move on to the problems. This is what needs to be resolved. The last one is receiving gratitude. This is where most of the people lack. We are very good in giving the compliments and appreciating others. But when it comes to receiving the gratitude, we are kind of like, it just kind of passes at the brain level. When somebody gives you a compliment or appreciates you, next time just think about it and take a few seconds to feel that compliment and appreciation in your heart. Let that feeling sink into the heart rather than kind of just like momentarily it registers in your brain and it kind of goes away. Or sometimes we rationalize it thinking that, oh, you are so nice, you are so good. But now just be open and think about, okay, this is the compliment that I got. Let me feel how it feels in my heart. So, and no practice is right or wrong. You can choose any of them, or you can try different ones and see what resonates the most with you. It's another exercise time. So now think about one recent experience when you felt grateful to the other person, or list one experience when you found something like you want to give a compliment to the other person. Just take like 10, 15 seconds to think about that experience. Whatever experience came to your mind, just hold on for a few seconds. And now let's take this gratitude to the next level. What you do is, after the session is done, express those feelings to the other person. Take a moment and express it. It could be either like through a text, through a phone message, like, or email, or like maybe if you want to just call them, whatever feels right to you. Take the time out and express those feelings to the other person. And why do we do that? Because if we feel gratitude and if we don't express it, it's like wrapping a gift and not giving it, which nobody likes, right? You want to wrap the gift and give it and deliver it to the other person. So, why is expression so important? There was one study that found that 90% of Americans felt grateful in their life, but only 52% women and 44% men expressed those feelings. And people who expressed were found happier than the group who didn't express. That's why it is so important to practice the gratitude, but at the same time, share it to the other person if you felt that compliment and appreciativeness for the other person. And guess what? Who gets the most, we take it them for granted? It's our loved ones. Many times we take things like for granted, and it's the loved ones where we express the feeling so less. And that is the most important thing, to recognize, to become aware, and to express those feelings to them. Now let's look at the practical implication of gratitude. So at personal level, you can choose any of the methods to bring gratitude into the day-to-day life. That's the journal, the letter, the meditation, the gratitude jar, ritual, or social media conversations, or receiving gratitude, right? You can them to bring gratitude into the day-to-day life. Workplace, like meetings, what did we do right? What are the positives? Or what are two things that you love about working at that place? Just having those conversations. And taking the practices and implementing into our patient's care, whether you are an inpatient setting or an outpatient setting, you can choose to apply these gratitude practices into your patient's plan of care. The important thing that I found here is to start practicing first at our level. Because once we practice in our day-to-day lives, it's way easier to educate the patients and to remind them and to train them to see the positives. For example, if you are in an inpatient setting, think just like when you enter the room, you can ask about what was the best part of your day so far, or what's the secret of your age, or like complimenting one thing in their surrounding, if they have a good view in the room, or if they are having a cozy blanket, or if there are like beautiful pictures in the room, whatever it is, training ourselves to see what is one thing that I really like about the surrounding and the patient's room, and how can I start the conversation. It's and whatever feels authentic to you. I'm not saying that just fake it up. Like, if we train our brains, then we can see something good and great, something that we can feel grateful for the other person. Or we can just say that I'm so glad to see that your surgery went so well. So something that would set up the tone, a positive tone for our session. If you are in an outpatient setting, I see so many my post-op surgical patients in the outpatient setting, when they reach a plateau in the range of motion, they are kind of like frustrated, and they're like, oh, why is it not going further? But just reminding them that how far they have come from the first day, sometimes it kind of brings the effort that they have put in, and that kind of motivates them to go further. So all those things you can blend in together with your patient's plan of care. If you are in an outpatient cardiac rehab system, you can bring the teachings of gratitude in one of the education class. We have seen how the evidence support this practice. So whatever resonates with your practice, I'm sure once you start doing it at the personal level, it's going to be way easier to blend it together with the patient's plan of care and to bring it at workplace. Key message is gratitude practice is a skill that can be developed. Of course, it takes practice like all other skills. And always remember that it is always, always, and always accessible, even in life's most challenging moments. All we need is just to reach for it. And mindfulness begets gratitude, and gratitude begets mindfulness. They both are like two sides of the coin. The more we are present to the present moment, the now moment, the more we can be appreciative, and the more we can be grateful. And the more grateful we are in the present moment. And when should we practice gratitude? Now is the time, because this is all we have. Life is not going to wait. What is going to happen tomorrow? We don't know. So now is our chance. Let's try to bring this practice into our day-to-day life. So to summarize the session, I shared about what is gratitude, why practice gratitude, how to practice, science and evidence supporting the gratitude, and different methods to practice the gratitude. If you are still on the fence of like, should I practice gratitude on a daily basis or not? I would highly encourage to come on my side of the fence and see for yourself. Take home message, choose one method, whichever method resonated with you, choose one method, practice it for yourself, implement into your workplace, patient's plan of care, and do it with fun and ease. And to take that practice to the next level, share and express. Thank you so much. And I'm really grateful to each and every one of you here for giving me this comfortable space to share the practice of gratitude. On that note, I would end here. And Sarah, floor is all yours for Q&A.
Thank you, Monica. Do we have any questions? We could do like a live question or a question to the chat, or if anybody wants to share a practice that has been meaningful for you, that would be cool. I'm really into that jar idea, especially with the family. You know, sometimes in the moment, I'm going crazy, but some reflection and then opening it later. Monica, I love that idea of doing it on Christmas Eve. Like, what a, you know, cool thing to pick a special moment and then share with the family. I love that.
Yeah, absolutely. Yeah, and this all conversation is like, the more we participate, the more we share. That's the way to get out of the session more and more. So whatever is coming to your mind, I would highly encourage to just share the experience or share what practice resonates the most with you, or how do you practice gratitude into your day-to-day lives. Because the more interaction we can have, the more we can learn from each other. There is no wrong or right answer. If there is like that thing that is coming in your mind, just share.
Okay, I think we have no questions, no comments, but that's okay. I'm so grateful. I'll echo Monica. So grateful for you all for joining us. Thank you for your time, your effort. Oh, wait, here we go. Yes, I agree that parasympathetic activity, I mean, that's, one more way to help downregulate our patients, right? Like, it's another tool in the toolbox, as they'd say. Thank you, Diana, for that comment. That's awesome.
Yeah, absolutely. Like with the chronic pain and like mind, and like, I have elaborated a lot more about the gratitude practice in my book, The Healing the Heart Mindfully, where I have like tailored the practice with the cardiac patients. So if you're interested, then you can read a little bit more about that.
Great. Oh, here we go. Diana, I'm going to be in touch with you. Don't worry, I'll find you. We'll get you some contact information. Sarah, thank you for sharing. Sarah, I'm going to read it out loud. I'm sorry. The SNF where you work gave all the employees a notebook and encouraged you all to write 5 things we're grateful for daily. It definitely helped the feel in the building. How cool.
Yeah, that's awesome.
Okay, everyone, thank you so much for sharing. Monica, thank you again. That was wonderful. So grateful. So grateful for all of y'all for joining us. Thank you very much.
Yeah. Thank you, everybody. Have a very good night.
Have a good night. Hopefully see you guys. See you some. See ya.